Task Force commenced the regular briefing, we had to postpone the briefing for Monday, 20th July 2020. On Sunday, 19th July 2020, the dangers that our frontline workers face on a daily basis was forcefully brought to our consciousness when the tweet from the Honorable Minister of Foreign Affairs, who is a member of the Presidential Task Force, went viral. That singular piece of information in the public space is sufficient proof to Nigerians that the virus is real and does not discriminate. Sequel to that development, the Presidential Task Force and its Secretariat immediately carried out a risk assessment and tested our members to determine their status out of an abundance of caution. Fortunately, as a precautionary measure, the PTF had earlier arranged that all journalists covering its activities should be tested equally by the Nigerian Center for Disease Control. I am pleased to inform you that testing of members of COVID-19 has been a regular exercise for the PTF, and that policy would be sustained. I'm also pleased to inform you that having successfully taken all precautionary measures regarding safety, the normal business of the Presidential Task Force has resumed. We will, however, not lower our guards for any reason because the nation cannot afford to shut down its response. Our prayers and best wishes are with the Honorable Minister for Foreign Affairs, who is doing very well and is stable, as it is with all Nigerians that have contracted the virus and the entire humanity bearing the burden of the pandemic. We wish them all speedy recovery. As we progress, however, the Presidential Task Force might reconsider restructuring the mode of delivering some of its activities, relying more on technology to minimize the risk associated with unavoidable physical contacts. Since the last time we briefed the nation, global and national developments continue to yield statistics that point at the fact that the virus is still very potent and spreading fast, that human efforts can speed to stop. WHO statistics show that India has joined the United States of America and Brazil in the category of countries that have recorded over 1 million cases. Cumulatively, 15,403,120 cases have been recorded from 215 countries and territories. On the African continent, the cumulative total for Africa has risen to 773,804, including 16,448 fatalities. Nigeria, with 38,344 cases, account for about 5% of the Africa's numbers. Similarly, Nigeria with 813 deaths account for 5% of fatalities in the continent. The message of hope is that the world continues to close its ranks in the search for a vaccine in a manner designed to guarantee rapid, fair, and equitable access worldwide. Back home, there has been a lot of debate on finding a local cure. While this is plausible expectation, the PTF, other relevant institutions of government, and the private sector working with our partners, shall pursue the path of research relentlessly. As we have often said, only a well-developed partnership will serve humanity. To demonstrate the commitment of government to research, on Monday, July 2020, I inaugurated the Body of Experts for Health Sector Research and Development Intervention Scheme established by the Central Bank of Nigeria under the chairmanship of the Director General of NAFDAC. The body is expected to address the challenges that limit research and development investment in the healthcare sector. While we do that, it shall be the duty of Nigerians to change their behavior and scale up their compliances with non-pharmaceutical measures. The best option is to totally avoid contracting the virus by staying safe. The aviation sector has been working assiduously to develop the protocols for the resumption of international air services, having done that of the domestic air services. This PTF remains conscious of the significance of the contribution of air travels to economic growth and shall continue to push for a safe resumption. The next phase is for the aviation regulators to engage with other stakeholders to facilitate an integrated and seamless resumption of international flights. I plead with all Nigerians to await authentic information from the aviation authorities and discountenance fake news and speculation on dates. As we approach the last 5 days to the end of this eased lockdown phase, the Presidential Task Force shall rigorously evaluate the developments on the basis of emerging data, evolving science, strengthen best practices and improvements in our risk communication strategy. All this would help us form an opinion upon which the next set of recommendations to Mr. President will be based. We also have cause to begin to advise Nigerians on the upcoming Eid el-Kabir festival. This naturally comes with lots of mass gatherings, but we must not forget that the guidelines are still in existence and the virus is still very potent. We urge all state governments to ensure that guidelines are adhered to, and citizens should not indulge in activities that would allow for the spread of the virus and lives are endangered. We are encouraged by state governments that have announced ban on Salah festivities and hope it will be upheld and replicated by other states. The national coordinator would also amplify on these issues. Today, the Presidential Task Force formally welcomed the new WHO country representative to Nigeria. The WHO has been a major partner in the national response, and Nigeria truly appreciates the support of the organization. The Presidential Task Force is happy to note that a number of civil society organizations are fielding medical missions across the country to further deepen awareness amongst the grassroots. While we would always appreciate their efforts, we call on them to work closely and collaboratively with sub-national level of governments so that a coordinated risk communication strategy would result in optimal outreach. The Presidential Task Force wishes to thank friendly nations and corporate organizations for their continuing support through donation of medicines and equipment. In this regard, we thank India, the nation of India, for the donation of 7 tons of hydroxychloroquine for treatment of patients. Similarly, we want to express our appreciation to Web Fountain Foundation, the Securities and Exchange Commission, and the NTA for the donation of 35 oxygen concentrators, 1 ambulance, and 500 phones, respectively. We wish to assure you that the resources will be judiciously utilized. The subnational entities have also escalated the levels of their ownership, and we will encourage them to continue, as that is the most practicable means of dealing with the community transmission phase of the virus. I must always remind all Nigerians to comply with measures put in place. Remember to wear your mask in the proper manner when in public. Do not share face masks, because any face mask that is already reused becomes a contaminated material and could be dangerous. Finally, dispose of your mask and other used item properly and safely. This will save others, including strict cleaners, from being exposed to dangers. Finally, the Presidential Task Force finds it necessary to re-educate Nigerians on the policy and strategy for the coordination and management of resources for the national response. For the avoidance of doubt, the Presidential Task Force provides leadership, guidance, and coordination. The resources generated by the private sector, especially COVID, is managed and delivered in kind on specific projects. The same goes for the deployment of resources in the United Nations One Basket Fund and the NMPC and partners support. The national coordinator will elaborate more on COVID and other resources from the international community. I now have the honor and singular privilege to invite the Honorable Minister of Health, the DG, NCDC, and the National Coordinator to present their updates. And I thank you most sincerely for listening.
Thank you. The Chairman of the Presidential Task Force on COVID-19 response, Honorable Ministers, Permanent Secretaries, National Coordinator, Director General, ladies and gentlemen. The COVID-19 cases recorded daily over the past weeks now fluctuate within the 500 to 700 bracket, with 543 new cases in the past 24 hours, bringing our confirmed total number in Nigeria so far to 38,344, of which 15,815 happily were successfully treated and discharged. We have regrettably recorded 813 fatalities, mostly with comorbidities, and also tested a total of 247,825 persons in all. That's nearly 250,000. We have a case fatality ratio of about 2.1%. We can rightly assume from the exponentially increasing numbers that the pool of potentially infectious persons in the community is rising gradually, and with that, the risk of infection for citizens at all levels of society, since a very significant number of persons testing positive may not show any symptoms and may not be in observation or treatment, and they are moving around among us. I must commend persons of influence in society who tested positive for COVID-19 and came out publicly to declare it and entrust themselves to prescribed treatment. They do us a world of good, but by showing that there is no shame and no danger and nothing to hide about COVID-19. And they also contribute immensely to building confidence in the health system. The Ministry of Health rededicates itself to doing everything possible to ensure that citizens get the best of treatment and are well taken care of. In this respect, I have received good testimony about some of our health institutions, like the University of Lagos Teaching Hospital and the University of Benin Teaching Hospital. I commend the CMDs of these hospitals and urge them to strive even higher for others to emulate. Nigeria expects the best of all our health institutions. But despite this, our focus is still on prevention, being better and cheaper than cure. From what we know of COVID-19 so far, we cannot reduce infection rates significantly without adhering to the public health advisories, such as appropriate wearing of face masks, physical distancing, and avoiding crowded places to escape the exponential infection rate that sustains COVID-19 at present. If we accordingly take responsibility, we can save lives, including our own and that of our beloved ones. The evidence on the side of wearing a mask to protect yourself and others is now incontrovertible. We should all comply. The Federal Ministry of Health, through the Nigeria Center for Disease Control, now has a total of 59 molecular diagnostic laboratories for COVID-19 activated. With a little improvement in logistics, the lack of availability of testing capacity should not be a tenable excuse anymore. I'm pleased to mention that all states of the Federation, including the FCT, are receiving support from the COVID-19 response through the Regional Disease Surveillance Enhancement Project. And as we announced, with this support, all states of the Federation will have 100 million naira to enhance high-impact priority response activities. The soon-to-be reactivated Basic Healthcare Provision Fund will join the funding pool for states. The High Commissioner of India, as has been mentioned just now, led a delegation of the High Commission to Nigeria to the Ministry of Health on Friday, 17th, to donate essential medicines and commodities in support of the Nigerian government effort in combating the COVID-19 pandemic. We thank His Excellency, the High Commissioner, and the government and people of India for the gesture. I also use this opportunity to express appreciation once again to all our other partners who have continued to stand by us. The National Institute for Pharmaceutical Research and Development, NIPRID, has now shared its final report on the evaluation of the COVID-19 organic from Madagascar. The initial temporary result had shown that its main ingredient is the same as Artemisia annua, which is grown in Nigeria. While the preparation at high dose showed activity in reducing frequency of cough, it did not show any evidence that it has a real curative property against the COVID-19 virus. However, we shall continue to support all genuine efforts towards finding local COVID-19 cures. The This-Day Dome Isolation Center has finally started admitting COVID-19 patients, and it is the most comprehensive of our treatment centers, fully equipped to treat mild, severe, and even critical COVID cases. It has ventilators, oxygen concentrators, and dialysis machines. On behalf of His Excellency the President, I also express appreciation to the Coalition Against COVID-19 group, who set up the center, and the CBN, Central Bank of Nigeria, who is providing hospitality to staff and patients. Personnel will be deployed to man the place by the Federal Capital Territory, and they will join the expert team from Irua Teaching Hospital, who have been assigned to ensure a smooth takeoff and mentor a critical mass of health workers to operate the center. On Tuesday, the 21st July, was the reporting day of the Ministerial Expert Committee, Advisory Committee on COVID-19, when the leadership of the Federal Ministry of Health and the agencies and departments received the second report from the chairman, Professor Oyewale Tomori. The findings were highly instructive and will be shared with agencies, the PTF, and stakeholders. As we approach the Salah period and the time of prayers, I join all those who wish our Muslim brethren well and urge them not to forget the precautions that have been prescribed so as to reduce the risk of COVID-19 transmission. All over the world, mass gatherings have been linked with mass infections and casualties, as we see in other countries, and we see in the media every day. We also see that places where they had gatherings, where they opened up, had to be shut down very quickly because of rising casualties, which is what we are trying to avoid, so as not to overwhelm the capacity of our own health system. Since the risk of crowding can never be ruled out in places of worship and also pose a serious hazard for COVID-19 transmission, it is very wise that persons who are vulnerable, and as by vulnerable we mean people who are elderly, who are obese, who are in treatment for hypertension or diabetes or cancer or HIV or TB, or maybe they have had a transplant or any other condition that is chronic, should better stay at home and pray at home. I also strongly advise that travel anywhere be avoided during this period, except for critical reasons. It may be helpful to advise that citizens get the right nutrients in these uncertain times to ensure best chances to build your immunity and strengthen capacity to resist infections. Food should include good amounts of fruits, vegetables, and vitamins. In conclusion, I should like to remind all of us that even though COVID-19 can present symptoms like fever, similar to malaria, they are not the same. Symptoms like cough, sore throat, fever, loss of sense of taste or smell, or difficulty in breathing, headache, are less. Those are the less common ones, or rather the less common ones are diarrhea, body pain, catarrh, shivering, and fatigue, especially when several of these symptoms occur together, may be suggestive of COVID, and a test is required. Please call your state hotline or the 112 emergency line or the NCDC hotline, or visit a sample collection center near you, which can be found on the NCDC website now. Thank you for your attention.
Chair of the Presidential Task Force and Secretary to the Government of the Federation, honorable ministers, gentlemen of the press, it's been a while. We missed you on Monday, so it's good to be back. Mondays are not the same without a press briefing with you. So today I thought to feedback a little bit on what we've been doing on the national strategy to scale up access to testing in Nigeria over the past few weeks. It's obviously taken up a lot of our energy, and it's important to feedback to you on where we are and where we hope to get to. A few weeks ago, I announced this national strategy to scale up our testing, and we really adopted a five-pronged approach to this. We set a target, which I made public, to test 2 million by the end of this month. But the target is a lot more than just the numbers, because testing in itself is not a goal. Our goal through testing is to bring people into care, accelerate them through the public health process, enable contact tracing to happen for those that are positive, and generally move the system along. That's the only way we can know where we are, restart our economy, live comfortably our own lives. So everything about this disease is ultimately dependent on our ability to gain insights into transmission, which we need testing for. So the first point is just in terms of the number of labs. We now have 59 labs activated in 29 states and the FCT across the country. So a lot of progress. We are working this week to cover the rest of the country. Right now, we have teams in Kebbi and Zamfara. Another team is in Gombe and Taraba, working to cover the country. So we're working very hard to make sure testing is available to every state in the country. There are currently 45 labs that can carry out PCR, real-time PCR across the country, and we have the rest gene expert labs activated. So 59 labs, 59 testing labs across the country right now serving Nigerians, and we're trying to accelerate this as much as possible. Now, the second prong of this five-prong approach is to leverage the high-throughput labs that already existed for HIV and convert them to test for COVID. So of the 6 PCR mega labs in Nigeria, we've activated 2 of them for COVID, the National Reference Lab and the Defense Reference Lab in Abuja. We have 1 in Lagos and Naima, 1 in Anambra, the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital have been activated for COVID testing. So that's a very important part of our approach, leveraging on existing laboratory capacity for HIV for COVID. Now, the third prong, which many of you know about, is the gene expert machines that are scattered around the country. We have over 400 of them in 399 health facilities. But the challenge is not in the gene expert machines themselves, is that we need to provide an additional level of safety. They're called biosafety cabinets in order to use this for COVID. So far, we have activated 13 of them in 10 states. So pushing very hard to make sure that with that gene expert technology, we can increase access to testing. The fourth point is to include the private sector in our testing architecture. So we've been working very hard with the private sector across Nigeria to include them. But they themselves have seen that it's not as easy as we might originally have thought. So we now have 5 in Lagos and 2 are almost there in Abuja. So we're hoping that once we have activated the 2 in Abuja, then we'll have 7. Sorry, there are 7 in Lagos and 2. There were originally 5. There are 2 more accredited recently, so we now have 7 and we'll have 2 in Abuja. And slowly, that will increase the capacity. I heard the couple in Port Harcourt that are also making progress. So with the inclusion of the private sector, we should be able to expand our testing even further. And we'll keep building as we go along. The fifth prong of this, our strategy, is to explore the role of rapid diagnostic test kits. So we've been working with the Medical Laboratory Science Council of Nigeria to validate a number of kits. There are two that are showing good promise. So that validation process is ongoing at the moment. And in the next couple of weeks, we'll be able to know at least whether those first two that showed the most promise are able to be included into our testing algorithm. So those are the approaches we're using to increase our testing capacity. But the other challenge, like you know, is many Nigerians have been complaining about the ability to get their test results quickly. Now, there are two channels for this. Firstly, is from the NCDC directly. Secondly, from the state epidemiologists, from whom you have to get your lab results anyway, just like for any other disease. So what we've been doing is create a platform, an online platform. So just like those that are used to buying JAM forms, once you have been tested and a result has been sent, you will get a code, and you can use that code to go online, download your result. If you need a printed version, be able to print it out and use it for whatever you want to use it for. So that platform is almost ready. We'll be piloting it in Abuja first, and once it demonstrates its utility, we'll scale it up across the country. So whoever has been tested can access their results once they've been notified that their results are ready through a text message that they'll get on the phones that they register with the system. So through that, we'll increase access and the timeliness of the results. So you can see from all of these how hard the entire system is working to improve access to testing. And all of this will be an incredible improvement, not only for COVID. Of course, we're implementing this for COVID. But you can imagine that all of this will serve Nigeria for many years to come, whether you have Lassa, yellow fever, in fact, any infectious disease. And hopefully we'll be able to actually roll this out for all the other infectious diseases, including TB in our country. So a lot of the innovation happening right now will serve the country for many years to come, many years into the future. So this is really to thank all our partners, the WHO, the Africa CDC, WAHO, from who we got a lot of test reagents very recently, for all their support in building our testing architecture. We're very committed to taking this forward. The Global Fund, UNICEF, so many other agencies have really been working with us to build up testing. Of course, the federal government of Nigeria has been our biggest supporter and enabled us the resources, and I don't foresee any challenge in terms of test kits in the near future, because we're really ramping up a stockpile of reagents across the country. Of course, the National Assembly has been very generous in supporting all the work that we're doing, and that is really an example of a collaborative effort across the country. But I think the most important people to acknowledge this evening are medical lab scientists that do the work. The 24 hours at the National Reference Lab, you find lab technicians, lab scientists working. It's the same across labs across the country, working in dangerous situations. Many of them have been infected themselves and have come back to work. We're very grateful for their efforts and their diligence. And I'd like to use my last seconds today to really thank all of you, all the lab technicians, all the lab scientists that have worked and continue working very hard on behalf of all of us to make sure those test results get back to patients on time and enable the entire system respond to this outbreak. So thank you very much.
The chairman of the Presidential Task Force, honorable ministers, members of the Presidential Task Force, gentlemen of the press, good evening. So today I would like to address the issue of misinformation with regards to COVID, and particularly the perception that COVID infects only certain populations. As mentioned earlier by the chairman, COVID has no respect for anybody. It's a very egalitarian virus that believes in the principle of equality. It's ready to infect anybody. It's certainly not a virus that discriminates. It doesn't know whether you are rich or poor, healthy or not. And it is absolutely not an elite disease. We know of many that are poor that have been infected with the virus. We know of many in the rural areas that are getting sick from COVID, while many have contracted it and are not even aware that they've had it. This is why it is important for us to continue to be vigilant and take steps to protect ourselves. There's no doubt that people are tired of COVID. There's no doubt that we are all tired of the pandemic. It has gone on for quite a while. But remember, the virus does not tire. It is not fatigued. It is looking for any opportunity to infect us. We should not give it that opportunity. It's important that we continue to ensure citizens' safety by prioritizing and ensuring that we follow the guidelines provided by the PTF on this. The other issue I wanted to talk about briefly is the issue of communications and strategy change with regards to this. As you are aware, through our risk communication pillar, we continue to do weekly polls, NOI polls, targeting thousands of Nigerians, both at the national and specific state levels. The PTF will be adjusting its communications approach and sensitization strategy based on our polling data and grassroots intelligence. We are trying to reach more and more Nigerians with life-saving information to mitigate the COVID infection. We are also trying to change people's behavior and ensure that the best preventive measures are applied across board by all of us. In this regard, the National Orientation Agency has been conducting community mobilization and sensitization programs in the hotspot local government areas linked with high burden of the disease. This includes sensitization on the use of face masks in motor parks for drivers and passengers, motorized campaigns in markets, door-to-door public awareness campaigns, as well as advocacy to community leaders. The private sector is a potent partner in this regard, and we continue to work with them to utilize their structures, especially when it comes to the social media, and to share data-driven messaging and behavioral change information to the grassroots. The task force is also partnering with the Federation of Muslim Women's Association and the Christian Associations of Nigerian Women to support our aggressive approach towards behavior change at the grassroots. I would also like to mention the critical partnership with other major radio stations, including Voice of Nigeria, Radio Nigeria, Wazobia, Ray Power, and a lot of others, too numerous to mention, in order to develop COVID-related programming that features COVID survivors, religious and traditional leaders, frontline healthcare workers, and other members of the public, so that we can foster a dialogue around COVID-19 and address some of the misinformation as regards whether or not COVID exists and whether or not it is really a health issue. It is only by working collectively and together that we can beat this disease. Finally, as mentioned by the chairman, next week we will be addressing the issue of Salah. We will be liaising with our religious leaders and build on the guidance we have already provided for places of worship to come up with a clear advisory on how Nigerians should best conduct themselves during this festive occasion so that they remain safe and we all remain safe. We will also be providing a summary of achievements by our key partners, including CACOVID, in line with our transparency principles. Thank you.
Thank you very much, National Coordinator. We'll move to the question session now. If you're ready, we're ready for your questions.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. I would like to start with you, Mr. Chairman, since the Foreign Affairs Minister is not here. So just yesterday, we got a report from the United Arab Emirates giving Nigerians whose visas have expired up till the 17th of August to leave their country or face legal consequences. So I would like to find out what are the implications of this for Nigerians who are yet to be evacuated from that country and those who do not have resources to pay for their air ticket to be airlifted back to Nigeria. Now, to the Minister of Health, so I'm sorry I have to bring up this issue again of hospitals rejecting patients. Just yesterday, DAC Communications PLC lost a senior consultant as a result of this rejection by hospitals. Yes, he tested for positive. He was still awaiting his result, and because of the symptoms was degenerating. So he was taken to about 3 hospitals here in Abuja, and he was rejected. Eventually, when he could access medical facilities, he gave up and died, I think, just yesterday. So it brings me to my question. Have there been any hospital that have been brought to book as a result of this rejection that have become a regular phenomenon? And to the Minister of Education, sir, some parents have contacted me saying that private schools have reached out to them to pay for third-term school fees, even as schools are yet to resume. So I don't know if the ministry is aware of this. And also still staying with you, sir, WAEC is a West African examination that about 5 schools are supposed to be participating, but Nigeria seems to be the only that Nigeria could actually do also, just to accommodate some of the peculiarities that is a major bone of contention for us. And also, I want to believe that since the decision was taken for Nigeria not to participate, you have been engaging with WAEC, maybe for a possible reschedule for just Nigeria alone as a country. Finally, sir, in the guidelines that you reeled out for safe resumption of schools, you said that schools should assess themselves and then send a report to the Ministry of Education. I'm a bit worried how authentic that report will be, making them the judge of themselves. I don't know if your ministry have come up with mechanism to check the preparedness of the schools for possible resumption. Thank you.
Good evening, sirs. My name is Friday Okerigbe. I'm a reporter with Channels TV. I think I will just start on the note of that school's resumption, and I will direct that question to the Minister of State for Education. There's been so much mixed information online as to when schools will be resuming. I'd like you to clear the air. Is there a particular date that schools will be resuming? My second question will go to the PTF chairman. I would like you to comment on this. It has to do with Naira Marley. Some time ago, we know that he flouted the protocols. I'm asking this question because we know that when rules are made and sanctions are not applied, people just don't listen to such rules. We've made so many rules here, but a lot of persons have flouted these rules without consequences. What is the update on Naira Marley? And then my second question will go to the PTF National Coordinator. Yesterday, when you briefed the Nigerian Governors Forum, you announced that the federal government made a provision of 2.1 billion naira each as an intervention, additional health funding for each state. My question is, how many states are going to benefit from that provision? Will it include states that, in quotes, are COVID-free? And the second question from that is, do you have a particular okay, I thought it's not listening. Do you have a mechanism, a strategy on ground to monitor the use of that fund that the federal government is giving to the states, as you announced at the NGF yesterday? My other question, we go to the Director General of NCDC. It has to do with an event that happened at the Gwagwalada Treatment Center at the weekend. It's an unfortunate one anyway, because someone who is close to me actually developed symptoms, and he lives close to Gwagwalada, so he went straight there. And of course, expectedly, since there is no test that shows that he's a COVID patient, he was not admitted. And then 2 days later, he got tested. But before the result could come out, he developed very critical a symptom. He couldn't breathe and was referred. He went back to Gwagwalada, where they also said they can't admit him as a patient because the result is yet to come. So the question is this: what is the procedure actually for admitting someone in the treatment centers? And you partially talked about it, but why does it take this long for people to actually get their results? Because some are dying in the process of waiting for their results to come out. And then the Minister of Health, I would like you to comment on this, my last set of questions. The United Kingdom has a new policy now that allows healthcare workers to come into the country and get visa on arrival. This is actually driving a lot of medical workers from countries, especially in Africa, in Nigeria inclusive. What is the government doing in that regard to ensure that the little health workers that we have that are not even enough for us will not take advantage of that and all of them migrate to such countries? And secondly, is the government also doing anything regarding those vaccines that show early signs of potency that countries are already mopping up in their countries, like the United States and even the UK? They're already mopping up some of these vaccines. 3 of those vaccines that were announced last week, they have high potency results from their preliminary testing. Are we planning anything similar to that so that we'll not be left out at the end of the day? Thank you.
Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Health. Sir, Nigerians will like to know how far we've gone with the renovation of 7 centers in the 18 or 20 local government hotspots for COVID-19 in the country. And more so, we'd like to know where this fund is coming from, because it's said to be 1.2 billion. We don't know if it's naira or dollars. So we'd like to know if there are donations or grants, or the state government or government will be paying for this. And also, where will these renovations be taking place? Which states, which of the states? So we can have a follow-up. To the DG NCDC, sir. Sir, Lagos and Kano states are the 2 leading states in COVID-19 testing. And you just mentioned that Lagos has 7 centers to test, while Kano has 5. And let's not forget that Lagos test positivity is between 20 to 40%, while Kano is between 1 to 2%. Now, we all know that in terms of, let's say, both states differs in terms of climatic condition. Now, in addition, there has been suggestions by different countries and science groups on the role of, possible role of humidity and temperature in the rate of transmission for COVID-19. Now, I would like to know if we are planning to record the relevant data to enable studies on the possible correlation between COVID-19 and environmental condition. Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. Well, from your opening statements, most of my questions were answered, but just remaining a few. And I'd like to start with the DG of the NCDC. Well, you spoke about ramping up our test capacity. What is our capacity at the moment? How many reagents do we have, and how far would that take us? And my next question also is for you. How many tests do we conduct averagely? Speaking daily now, because we're seeing this result come out every day, and we're seeing the numbers really go up. Yes, we know we haven't peaked yet, but we need to know average. how many tests we conduct. And finally, to the Minister of Health. Well, sometime about 2 weeks ago, you had actually announced that hospitals in Abuja will become sample collection sites. How far with that announcement? I asked this because the Gariki Hospital, I had a reason to go there, and there was a suspected case of COVID, but they say they are not accredited to take any samples or even hold any patient there. And also, some time ago, you had spoken about hospitals creating a space, even though a person hasn't carried out a COVID-19 test, but at least a place where they can be managed instead of being turned back. Is that applicable to every hospital in the FCT and across the country, or is that for specific health facilities? We need that clarification so that way people know where to go just in case. Thank you.
Ẹ kú dédé àsìkò yìí o gbogbo ẹ̀yọ́ ọmọ orílẹ̀-èdè Nàìjíríà jákèjádò gbogbo àgbáyé. Ní ìrọ̀lẹ́ yìí, màá fẹ́ mínísítà wá fún ètò ìlera ní ti abẹ́lé, Sẹ́nitọ̀ Adeleke Mamora, kán bá wa dáhùn àwọn ìbéèrè èyí tí mo fẹ́ béèrè lọ́wọ́ wọn ní ìrọ̀lẹ́ yìí. Àkọ́kọ́, mo fẹ́ bẹ̀rẹ̀ láti ibi tí iléeṣẹ́ amóhùnmáwòrán ti Channels tó ti kọ́kọ́ bẹ̀rẹ̀ nípa ìtọ́jú àwọn tí wọ́n ní àrùn yìí nílé ìwòsàn. Ó ṣe ní láàánú wípé ọmọ kékeré kan ní ìjàmbá mọ́tò, wọ́n sì gbé lọ sílé ìwòsàn. Ṣùgbọ́n nítorí pé àrùn COVID-19 tó wà níta, àwọn onítọ́jú wọn ò tọ́jú ẹ̀, ó dẹ̀ gbabẹ̀, ó di olóògbé. Ǹjẹ́ a lè sọ wípé eléyìí bójúmu àbí ó kù díẹ̀ káàtó? Ìlú Àbújá níbí báyìí ni eléyìí ti ṣẹlẹ̀. Èkejì ni wípé ẹ̀ẹ̀mélòó ló yẹ kí èèyàn ṣe àyẹ̀wò àrùn COVID-19 láti mọ̀ bóyá lótìtọ́ àti lódodo lẹ́yìn ní àrùn COVID-19, nítorí pé ó ṣeé ṣe kéèyàn kọ́kọ́ ṣe àyẹ̀wò lákọ̀ọ́kọ́ kó rí pé òun yege, kó wá padà lọ lẹ́ẹ̀délé bóyá ọjọ́ kejì àbí ọjọ́ kẹta kí àrùn COVID-19 bẹ̀rẹ̀. Báwo ló ṣe fẹ́ ṣe? Ǹjẹ́ ó ní láti padà lọ ṣe àyẹ̀wò ni àbí kí ni ìgbésẹ̀ tó yẹ kó ṣe? Èkẹta, nípa ti ètò ẹ̀kọ́, ìpínlẹ̀ Ọ̀yọ́ a rí wípé wọ́n sọ pé wọ́n fẹ́ jẹ́ kí àwọn ọmọ iléèwé kó padà sí iléèwé. Ṣùgbọ́n táàmù kẹta tí a mọ̀ sí third term, kò sí nǹkan tó jọ bẹ́ẹ̀ ní ìpínlẹ̀ Ọ̀yọ́. Kí lẹ lè sọ nípa eléyìí fún àti jẹ́ kí àwọn òbí kí ó lè yé wọn ní yékéyéké? Bákan náà ní ìpínlẹ̀ Ògùn. Okay, I will say it in English so that you can understand, sir. So, so in Ogun State, sir, ní ìpínlẹ̀ Ògùn, my minister, sir, ní ìpínlẹ̀ Ògùn, ìṣẹ̀lẹ̀ kan ṣẹlẹ̀ níbẹ̀ débi wípé arákùnrin yìí wọ́n ní pé kò tẹ̀lé òfin èyí tí wọ́n fún wọn lórí àrùn COVID-19. Ṣùgbọ́n nígbà tó débi tó ti fẹ́ jẹ níyà, wọ́n ní kó mú owó wá. Owó tó rí kò pé, ó padà, wọ́n gba mọ́tò ẹ̀ sílẹ̀. Nígbà tó máa padà dé, wọ́n ní pé àwọn ò lè gba owó yẹn. Ó ṣe ní láàánú wípé lójú wọn ń bẹ̀ yẹn ni arákùnrin yìí ti gbóògùn jẹ tó dẹ̀ gbabẹ̀ kú. Ṣafẹ́ sọ pé lára àwọn tí àrùn COVID-19 pa ní eléyìí ni àbí àìsàn owó ló jẹ́ kí àrùn yìí pa? Eléyìí tó wá gbẹ̀yìn ni pé mo fẹ́ rọ iléeṣẹ́ elétò ìlera lórílẹ̀‐èdè Nàìjíríà. Àwọn onímọ̀ ìjìnlẹ̀ pọ̀ lórílẹ̀‐èdè yìí tí wọ́n jẹ́ ọ̀dọ́, àwọn míì gan tẹ̀ ti sá lọ. Ṣé bí àwọn dókítà lásán pé wọ́n fẹ́ sá lọ sí ìlú òyìnbó? Àwọn onímọ̀ ìjìnlẹ̀ gan lọ nítorí pé kí ni? Ó dàbí pé wọ́n káràmásìkí wọn ní ilẹ̀ òkèrè ju orílẹ̀‐èdè Nàìjíríà lọ. Mo fẹ́ kí iléeṣẹ́ elétò ìlera kó wo àwọn bíi NCC, Nigeria Communication Commission, àwọn NITDA àti Federal Ministry of Science and Technology láti lè rọ àwọn ọ̀dọ́ yìí láti padà wá láti lè ṣiṣẹ́ èyí tó dára, kán bá lè ràn wá lọ́wọ́ lórílẹ̀‐èdè Nàìjíríà. Ẹ má jẹ́ ká sọ àwọn èèyàn tí a ní orílẹ̀‐èdè inú. For the Federal Minister of Education, sir, so that you understand it in English, what I asked my minister is about education, sir. In Oyo State now, the government said the pupils can resume in September. There is nothing like third time. What can you say about this? Thank you very much, sir.
Good evening. Good evening, the chairman and members of the PTF. My name is Mitaire Ikben. I report for the NTA. I have just one question for the DG of the NCDC. It's good to know that we now have about 59 molecular laboratories nationwide, but there's still a problem of getting across to the NCDC. Abuja is a peculiar case. People call and they say they cannot reach the NCDC. In fact, it is almost becoming a case of if you are not connected, you cannot reach the NCDC. If you don't know somebody who knows somebody who knows somebody that can get across to the NCDC, then you can't reach the NCDC. And it's as bad as for some of us here as journalists, we have some complaints have come to us, and we have forwarded them to the appropriate quarters, and it still gets up to 3 days before persons are attended to. I know that these complaints are not new to you as the DG, and that's why we want to know what you are doing to bridge the gap in getting across to the NCDC. Thank you.
Thank you. We've taken all the questions, and we'll be receiving responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of State Education, and the Honorable Minister of State Health. The Chairman, PTF, will round it up after all the responses. We'll begin with the Honorable Minister of Health.
So thank you for the questions. The first one is about patients being rejected in the treatment centers in hospitals. That is regrettable. It is not what should be happening anymore. Yeah, it is true. I had a meeting with the Honourable Minister of the FCT a couple of weeks ago, in which we dwelt on this topic and called all medical directors and chief medical directors of both federal and FCT-owned hospitals to impress upon them that nobody should be rejected. We are going to repeat that with private hospitals. We are preparing the grounds for that, to call private hospitals and also speak to them on the same topic. The policy of the government is that all persons who come to hospitals should be given attention, no matter how basic, and to call for help. But of course, we are still working on improving our programs, and part of that is the communication we give here every day, that people who are tested positive should not disappear. You should register yourself. We say that every day here, and today I also pay tribute to influential persons who declare, yes, I tested, I was positive, I'm going to treatment. It's a good example. So we believe that if more people were doing that, then the number of surprises of people fall suddenly ill at night and they are looking from one place to the other, the number will be less if people would actually comply with that. And I express my deep regrets to the family of the person you mentioned. I think we said that communication. I deeply regret my condolence to the person and to the family. It's a deep loss. That's the kind of thing we are trying to avoid, that we lose anybody to COVID-19. We're always talking about reducing fatalities. And we can only do that with cooperation of all citizens. And part of it is that anyone who tests positive should present themselves for treatment. If they have comorbidities especially, they should in fact go on admission so as they are supervised all through the time. The other strategy we have is that we have instructed every hospital to also be ready to test, ability to test. That one is still ongoing. I think there are about 7 of them now that are already prepared to do testing, to take samples. The DG of NCDC will speak more about that because they set up this system that you can collect samples at certain hospitals, various hospitals. It's not a big deal, but they're prepared, who are equipped, trained, and ready to be able to collect samples and have them collected. That is in progress. And then we are also setting up, which is already functioning, an ambulance system that you can make a call, and then the ambulance will pick you up and take you to where you will be treated, so that you are not the one running from one place to the other looking for a place of treatment. So that is already in the work here. We did one, we set it up in Kano, and it's worked very well there. And we're setting up here in Abuja. I was given a report this morning that they're already operating skeletally, and they'll be scaled up. So that if you call a number, you have symptoms, you're in dire distress, you can call and you'll be taken to where you definitely be treated. Because not everybody knows the best place to go to. If you go to a hospital next door, which is not ready for you, they will tell you they won't be able to treat you. But we also urge even such hospitals to at least give oxygen and then call for the ambulance. All clinics should know the ambulance number by now. So we request that all citizens be ready to comply with these guidelines that we have given. If you have comorbidities, please report. And if you feel that you are getting bad, funny symptoms, which I listed just now, I listed them during my speech today. If you have any of those symptoms, you have to go early enough to an accredited hospital for testing. Don't wait and say, okay, till tomorrow you will go, because COVID does not know day or night. So if you get symptoms at 6 p.m., you say, okay, tomorrow you will go, it may be too late. He doesn't know, he won't wait for you. Nothing is going to wait. So you have to act fast and avoid situations where things now become an emergency, which would also not have been. So please, everybody report in time, and we shall reduce, that's our objective, to reduce the casualties. Now, with the question of vaccines, yes, we are observing the development on the vaccine. There are several vaccine candidates being tested in various countries right now. Everybody is scrambling to get the vaccines. The High Commissioner of India spoke in that respect when he visited us some time ago, just a couple of days ago, to say that India is also working on developing a vaccine. I've heard the president of China make the same statement. In America, they're obviously doing a lot of tests, and the UK and other countries in Europe, everybody is scrambling for vaccine. Now, His Excellency the President has started an initiative by which the African bloc of countries should work towards getting access to vaccines. That initiative is ongoing to be able to make sure that Africans are not shortchanged when vaccines do come out. And it's our prayer that these vaccines come out in large areas, in large numbers and in multiple sites. With regard to the hotspots and the 2.1, I will leave that to the national coordinator. He is the one looking at the hotspots in the country, the local governments that are particularly suffering from the widespread infection of COVID-19, and also the question of allocation of funds from those sources. Now, we have spoken about the sample collection site. Our objective is to make sure that all hospitals are able to take samples. Taking samples is not a big deal. All you need is a good logistics to collect all of them. Most of the PCR machines have capacity to test large numbers at once. They can test several, do large numbers. So if you collect all the samples, you can do one test, you can get many results coming up. They are, as we know now, they are being used at less than 40% capacity. So the logistics is what has to be done properly and with some more experience. The management of cases, it's not every hospital. There are specialized hospitals that are doing COVID-19. Isolation hospitals, we are told, we've named them here before many times. Those are the only ones taking care of COVID-19. But any other hospital that intends or desires to participate in treating COVID-19 patients can request for accreditation. A team will come and accredit the hospital, and ex-specialists can help to demarcate the areas, the so-called clean and dirty areas for you, and give you necessary training and make sure you have the necessary staff So that is possible. But if you are not accredited, this is not something that anybody should be treating anyhow. Okay, with regard to the doctors, well, you see, this period is a very uncertain period where all countries are looking for doctors from everywhere and trying to make sure that you don't only think of buying equipment, buying commodities, buying that. You also want to increase your manpower, and they are ready to take manpower from everywhere. So we are trying to see that we keep our own manpower here. As you know, there are incentives that have been given, like life insurance and hazard allowance and so on. All those ones have been provided. And we hope to continue to chatting with our resident doctors and urging our state governments to actually employ the doctors who are unemployed and make sure that the availability of manpower for health is not compromised. So I think that that will be the subject of conversation when we speak with the NMA and the Association of Resident Doctors. So I think that is all we have here. The number of hospitals that can take samples will continue to increase. We hope that we can be able to help many hospitals to at least take care of emergencies that come in and then call for help, that you have an ambulance system that will come and pick up the patient from where they first arrived and take them to a designated treatment center. So when that system starts working, we see the value of a medical emergency system. As you know, we are working on what we call a national emergency medical system and medical service and ambulance system. National Emergency Medical Service and Ambulance System, NEMSAS, which is under development to be able to provide services of all kinds of emergencies, including obstetric. Those who can't, who have delivery issues and so on, you can call a number and the ambulance will come to pick you up. Paramedics will be on board. That system is under development. We have a consultant helping us with developing that system. Thank you.
So thank you, gentlemen of the press. I think we'll start with Friday. Friday, thank you very much. It's really unfortunate the experience your colleague had. And I think the Honorable Minister has already addressed the issue of waiting and rejecting patients. You know, no hospital should be doing this. Most hospitals have set up holding areas where when there's uncertainty about a diagnosis and the individual is showing symptoms, every hospital should have a holding area. We've been supporting hospitals. We have an IPC team that has been supporting all the tertiary hospitals in Nigeria to set up triage centers. A triage center is when you come in, you test. When you come in, you're screened. If your symptoms are similar to what could be COVID, you're put in a holding area until we can determine the diagnosis. But, you know, the tools that we have to force hospitals to do these things, you know, we live in the country we live in. So we keep pushing, we train, we support, and we hope that eventually we'll get better. You know, maybe whatever hospital is watching this, there's no way around this. We have to live with this situation for the next 1 year, at the very best. So we can't turn our patients away. The technology that we have for testing, even if it works optimally, cannot provide us a test